tingling, burning, numbness, or worse, that sharp stabbing feeling like you're walking on broken glass. If that sounds familiar, you're not alone. Millions of people, especially over the age of 60, experience these exact symptoms every single day. At first, it seems small, just a little tingling in your toes, a slight burning sensation at night. But over time, it spreads. Your feet feel different, unstable, disconnected. You start to lose confidence when you walk. Balance becomes uncertain, and deep down, a question begins to form. Is this something serious? Most people are told the same thing. It's just aging. But what if that's not true? What if these sensations are actually a warning sign that your nerves are starting to break down? Because that's exactly what's happening. Your body is trying to send signals, but they're getting scrambled along the way. And if nothing changes, those signals may fade even more. But here's the part most people never hear. What if this condition is not permanent? What if your nerves could actually recover? That's exactly what we're going to explore. When these symptoms appear, most people do the same thing. They look for a pill, something to numb the pain, to stop the burning, to make the discomfort go away, and at first, it seems to help. But here's the problem. These medications don't fix the cause. They don't repair your nerves. They don't restore the signal. They simply mask the symptoms. So the damage continues, quietly. Because neuropathy isn't just about pain. It's about broken communication inside your body. And covering it up doesn't solve it. But what if the solution isn't another pill? What if the real answer is something your body was designed to respond to? Movement? This isn't just a theory. It's backed by real science. Researchers at the University of Utah conducted a groundbreaking study on people with neuropathy. Before the program began, they took small skin samples to examine the nerve fibers under a microscope. Then participants followed a structured exercise routine over time. After the program, they repeated the biopsy, and what they found was remarkable. The nerve fibers had started to grow back. Not just improved symptoms, not just feeling a little better. Actual, measurable regrowth of nerve endings, visible under a microscope. That changes everything, because it proves one powerful idea. Your nerves are not permanently damaged. They can respond, they can adapt, and under the right conditions, they can begin to repair themselves, which means this isn't about managing decline. It's about activating recovery. To understand how to fix the problem, you first need to understand what's causing it. The number one cause of neuropathy is diabetes. High blood sugar triggers a process called glycation, where sugar binds to proteins in your nerves. Over time, this creates damage, like a sticky coating that disrupts normal function. Signals become distorted. Communication breaks down. But diabetes isn't the only cause. Vitamin deficiencies also play a major role, especially vitamin B1 and B12. These nutrients are essential for nerve health. Without them, nerves lose their ability to repair and transmit signals properly. Alcohol is another major factor. It directly damages nerve tissue and blocks the absorption of key vitamins, making the problem worse over time. Certain medications can also contribute, especially those that interfere with nutrient absorption or nerve function. And here's something surprising. In nearly 30% of cases, doctors never find a clear cause, which means neuropathy isn't always obvious. But regardless of the cause, the result is the same. Your nerves stop working the way they should, and that's where the real problem begins. Alongside exercise, certain supplements can support nerve health, but they need to be used correctly. The one with the strongest evidence is alpha-lipoic acid, ALA. At a dose of around 600 milligrams per day, clinical studies have shown it can reduce symptoms like burning and tingling by up to 50%. Another key nutrient is vitamin B12. If your levels are low, especially if you take medications like metformin, your nerves may struggle to function properly. But here's something many people don't realize. Too much vitamin B6 can actually cause nerve damage. Doses above 50 milligrams per day may worsen neuropathy instead of helping it. So when it comes to supplements, it's not just about taking more. It's about taking the right ones in the right amounts. If there's one thing that makes the biggest difference, it's this: cardio. Not supplements, not medications, movement. Research shows that regular cardio is what actually triggers nerve regrowth. Why? Because your nerves depend on blood flow and oxygen. When circulation is poor, your nerves don't get what they need to repair themselves. But when you move, blood flow increases, oxygen delivery improves, and your body switches into healing mode. The goal is simple: 150 minutes per week. That could be walking, cycling, swimming. But here's something even simpler, something you can do right at home. Seated march. Sit on a chair. Keep your back straight. Lift one knee at a time, like you're marching in place. Add your arms for rhythm. Go at a pace where your breathing increases slightly, but you can still talk. Start with 3 minutes, then slowly build up to 10-15 minutes per session, twice a day. That alone gives you 20-30 minutes of cardio daily, with almost zero risk of falling. And here's the key: consistency. Because every time you move, you're sending more blood, more oxygen, and more support to your nerves. Not just reducing symptoms, but helping your body repair from within. Cardio starts the healing, but balance is what keeps you safe. Because one of the biggest dangers of neuropathy is not just pain, it's falling. Neuropathy affects something called proprioception, your body's ability to sense where it is in space. In simple terms, you stop feeling the ground as clearly as before. Your brain gets less information from your feet, and when that happens, your ability to stay balanced weakens. That's why even a small misstep can lead to a serious fall. So we need to retrain that connection. The first exercise is the single leg stand. Stand behind a chair. Hold the back for support. Lift one foot slightly off the ground. Hold for as long as you can, even if it's just 5 seconds at first. Build up to 30 seconds per side. Then, when you're ready, try using one hand, then no hands, and eventually close your eyes. That's where your nervous system works the hardest. The second exercise is heel-to-toe rocking. Stand with your feet shoulder-width apart. Slowly shift your weight onto your heels, lifting your toes slightly. Then roll forward onto your toes, lifting your heels. Move slowly and with control. Repeat 15 times for 2 sets. Each movement sends a signal to your brain. I can feel the ground. I am stable. And over time, that connection gets stronger again. Now we move to the most targeted part: exercises that directly wake up your nerves. With neuropathy, the small muscles in your feet begin to weaken. Why? Because the nerves that control them stop sending strong signals. So these exercises are designed to reactivate that connection between your nerves and your muscles. The first is calf raises. Stand behind a chair for support. Slowly rise up onto your toes. Hold for a count of 2. Then lower back down just as slowly. Repeat 12 times for 2 sets. This does 2 important things. It improves blood flow to your feet. It strengthens the muscles that support nerve function. Next is towel scrunches. Sit in a chair. Place a towel on the floor. Use your toes to grab and pull the towel toward you. At first, it may feel difficult, like your toes aren't responding. That's normal. You're activating nerve pathways that haven't been used in a long time. Do 10 repetitions per foot for 2 sets. Finally, ankle circles and the alphabet. Lift your foot slightly off the ground. Rotate your ankle in circles 10 times each direction. Then, use your big toe to draw the alphabet in the air. Each movement challenges your foot in a different direction, improving coordination and nerve signaling. These exercises don't just strengthen your feet, they retrain your brain to reconnect with them. Now, let's bring everything together into a routine that's simple, effective, and easy to follow. You don't need hours. You don't need a gym. You need just 15 minutes a day. Break it into 3 parts. Part 1, cardio. Seated march or light movement for 5-10 minutes. Part 2, balance. Single leg stand and heel-to-toe rocking. About 3-4 minutes. Part 3, foot exercises. Calf raises, towel scrunches, ankle circles. Another 4-5 minutes. That's it. But here's the key. Consistency beats intensity. Doing a little every day is far more powerful than doing a lot once a week. Nerves don't respond well to sudden overload. They respond to steady, repeated signals. So start small. If an exercise says 30 seconds, Begin with 10. Build gradually over time. And one more important rule. Check your feet after every session. Look for redness, blisters, small cuts, because when sensation is reduced, you may not feel injury right away. 1 minute of checking can prevent a serious problem later. Keep it simple, stay consistent, and let your body do the rest. When you look at the full picture, everything starts to make sense. Neuropathy is not just something you have to live with. It's not simply part of getting older, because science has shown something powerful. Nerves can regrow. Not overnight, not instantly, but with the right signals, the right movement, and consistent effort, your body can begin to repair itself. Every step you take, every exercise you do, you're not just managing symptoms. You're sending a message to your nervous system. Wake up, reconnect, heal. And over time, those small signals add up. Balance improves. Strength returns. Confidence comes back. So instead of feeling stuck, you now have a plan. Start small. Stay consistent. And trust the process. If this video helped you, leave a comment below. Which exercise are you going to try first? And share this with someone who needs it. Because the earlier you start, the better your results can be. Your nerves are not done yet.